Good afternoon, everyone. Thank you for joining, and a warm welcome from Geneva to the World Heart Federation webinar on our new CVD Advocacy Toolkit, The Road to 2018. My name is Jeremiah Mwangi. I'm the Director of Policy and Advocacy, and it is my great pleasure to introduce my colleagues Joanna Mark-Reiter, our Policy and Advocacy Manager, and Alistair White, our Advocacy Assistant. And we are delighted to see so many of our members join us today from around the world, and we look forward to working together to improve heart health. Before we begin, just a note to say that we are recording the webinar so that it can be shared for those who can't join or if you need to jump off for any reason halfway through. There will be time for questions during the presentation, so please note down any queries you have. So we'd first like to mention that the main focus of today's webinar will be our new CVD Advocacy Toolkit. If you haven't had a chance to read it, you can access an online version via the link on this slide. There's also a link to the toolkit on your webinar invitation and on the email confirming your registration for the event. Jumping straight into the agenda for today's webinar, we will start by giving you an overview of what progress has been achieved at the global level, before focusing on the UN high-level meeting on NCDs in 2018. We will mention why it represents such a unique advocacy opportunity and how it marks a change in focus from global to national action. We will then take you through each section of the toolkit to ensure you are familiar with its contents. Following this, there will be an opportunity for you to raise questions and share any comments that you have. We will then speak briefly on the next steps and action that you can take for CVD advocacy around the high-level meeting. We are very interested to hear your thoughts and plans for the meeting and your experiences from previous high-level meetings. So I will now hand over to Alistair, who will give you an overview of our advocacy and the high-level meeting in 2018.
Thanks, Jeremiah. So before we move on to the toolkit itself, I'll just speak briefly about the World Heart Federation's CVD advocacy work and where and how this takes place. Firstly, why do we advocate? We aim to improve awareness around CVD and its global impact, in particular in low and middle income countries. We also want to ensure that there are stronger policies that allow people to lead heart-healthy lives. We also advocate for more resources, especially financial, to combat CVD, which is still proportionally an underfunded area compared to the burden of disease. We also encourage multi-sectoral cooperation so that all actors in different fields are working together towards the same 25 by 25 goal, that is, reducing premature mortality from CVD by 25% by the year 2025. We also aim to ensure that government actions to address CVD are sustainable and that they are being held accountable for their actions and the commitments they've made. Secondly, where do we advocate? Our advocacy work mainly takes place through the WHO at the World Health Assembly in May each year and at the Executive Board meetings, although we also advocate occasionally at UN meetings and through the WHO regional office meetings. We also support advocacy that takes place at the national level through our members when they lobby their governments. And thirdly, how do we advocate? We deliver policy statements in the meeting sessions themselves on topics such as the global shortages of essential medicines. These meetings also offer us a chance to speak directly to government representatives to press the case for CVD, so face-to-face advocacy is also a big part of our work. And we also make policy recommendations, both through our own publications or through other UN and WHO consultations. Just to recap the political context and timeline leading up to the third high-level meeting. The high-level meetings on NCDs convened by the UN are a series of meetings that have been held since 2011 in New York City. The first of these was held in 2011, and this resulted in the UN Political Declaration on NCDs, which put the prevention and control of NCDs high on the development agenda. The second HLM took place 3 years later in 2014, and led to an outcome document that committed countries to 4 time-bound commitments, in addition to a target of reducing premature NCD deaths by 25% by 2025, a target that the WHF has adapted for CVD. Then, in the following year, in September 2015, UN member states endorsed the Sustainable Development Goals, or SDGs, which include a target of reducing premature mortality from NCDs by 1/3 by the year 2030. The adoption of the SDGs and the inclusion of a specific target on NCDs strengthens our position as it aligns with the 25 by 25 targets and places CVD and heart health within the global development agenda. We are now approaching the third high-level meeting, also referred to as HLM 2018, at which global leaders will assess national progress on NCDs through the 4 time-bound commitments agreed in 2014. The third higher-level meeting is so important because country progress on tackling NCDs has been, according to WHO Director General Dr. Margaret Chan, insufficient and uneven. This is in some ways an understatement. At the end of 2015, 138 countries had shown very poor or no progress towards the 4 commitments, so urgent action is needed. As you can see from the timeline, 2018 represents a halfway point between the signing of the political declaration and the deadline for NCD targets in the Global Action Plan on NCDs, the year 2025. It is therefore a unique opportunity to put pressure on governments to increase action to tackle NCDs. The WHF have written our advocacy toolkit to help take advantage of the advocacy opportunity that this meeting offers, and we hope it can support members to advocate to their governments as national action is urgently needed. I'll now hand over to Joanna, who will take you through the different sections of the toolkit.
Hello everyone, thanks again for joining. It's my pleasure to quickly run you through the various sections in the toolkit that we've provided for you. We'll give a brief outline of the contents, but we expect most of you have read it already. So the more important things we'll be sharing today will be some additional tips, a few practical hints, and really giving you our expectations of where this work will lead to. So we'll start with the introduction, which you can find on pages 4 and 5 of the toolkit. You can see the page numbers as we go through these slides in the top right-hand corner of the screen in front of you if you're on your computer. So this introductory chapter provides an overview of the toolkit. It outlines why taking action on CVD in the lead-up to the high-level meeting is so critical. And as you can see from the slides, it provides some statistics on the scale of the CVD burden globally. Now, hopefully all of you will know this isn't the first advocacy toolkit that the World Heart Federation has produced. In 2015, we published the CVD in the Development Agenda Advocacy Toolkit, and this previous resource provided a thorough grounding in basic advocacy tactics and strategies. So we do encourage you to take a look at this previous resource if you haven't already. A hyperlink is included on the slide if you're watching via computer link. So moving on into the more meaty sections of the toolkit, the second chapter from pages 6 to 9 is entitled Global CVD Advocacy 2015 to 2018. And as the title suggests, it offers an overview of the current global health context. So this includes details on the Sustainable Development Goals, or SDGs for short, and also the position of health, NCDs, and critically CVD within this SDG framework. So NCDs have been included as a specific target within the Sustainable Development Goals, and the wording of this target is to reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and to promote mental health and well-being. So quite a weighty target for us to try to meet there. Luckily for us, this global target correlates very nicely with our original 25 by 25 shared goal. What it's done is help to gain new political momentum to the cause we were already fighting. So this chapter of the toolkit has no specific direct action recommended for you, our members. It's more of an information platform, and it's useful to read this section and especially to familiarise yourself with the Sustainable Development Goal process. We find that all governments have signed on to this agenda, and they very much view health and development issues within this context. So it's good to be aware of the politics around this. Of course, if you have any questions about the Sustainable Development Goals and how they affect our advocacy and how they would or could affect your advocacy, we're very happy to answer these via email. There will also be an interactive part of this webinar where you can type in your questions. So if you have any burning comments or questions, please do store them up for then. So setting the context for CVD advocacy must also include a careful look at the 4 time-bound commitments that Alistair mentioned earlier. Now, these 4 time-bound commitments were set at the last high-level meeting in 2014, and we feel that there are specific actions that countries must take in order to meet these 4 really very simple commitments. So to refresh your memories, the 4 commitments that governments agreed to honour in 2014 were: number 1, to set national NCD targets for 2025. Number 2 was to develop multi-sectoral policies and plans to adequately address NCDs. Number 3 was to reduce the risk factors for NCDs. We're all very familiar with the 4 major risk factors. And the 4th time-bound commitment was to strengthen health systems to address NCDs. So they're fairly straightforward, these time-bound commitments, but unfortunately, as we mentioned earlier, and as many of you know from your own experiences in your own national settings, in your own local settings, many countries, in fact most countries, are failing to meet these time-bound commitments. They're failing to meet their targets. So as part of the high-level meeting toolkit we've prepared for you, we've included the 4 recommendations for member states, which is another word for governments. Now these 4 recommendations we've put on the slide if you're following by computer. If you're not, I'll read them, summarise them now for you quickly. So we aim to persuade member states, both as ourselves from our office in Geneva, but also, and more importantly, through our membership, we hope to persuade them to step up their commitments to achieving the SDGs, especially Goal 3 on health. We urge member states to commit more human and financial resources to the fight against NCDs. We also urge member states to invest in strong monitoring mechanisms to track progress on NCDs. So many of you have already engaged with the World Heart Day policy theme on better data monitoring for cardiovascular disease. That's just one arm of our advocacy around this important area. And our 4th recommendation is that governments, and in fact all of us in the CVD community, must collaborate. So collaboration with all of the key groups across the NCD community. So these simple recommendations can help member states to meet the commitments they have already made but are failing to meet at previous high-level meetings. We can't overstate the urgency of countries actually meeting these commitments and implementing the actions as soon as possible. As Alistair mentioned, we're halfway to our deadline year of 2025, and many countries have fallen behind on these 4 very basic commitments. However, not all doom and gloom. We have identified experts and our own experience as advocates here at the World Heart Federation to develop practical steps to help us as a membership organisation to make a difference and to try to reverse this negative trend in cardiovascular policy. So you can find some of these insights in the 3rd chapter of the toolkit, the one titled What You Can Do. From our perspective, it's the most important part of the toolkit. It's definitely the chapter of the toolkit that we put the most time and effort into. It provides tips guidance on how to conduct your own CVD advocacy. So it's really tailored directly to our membership. It's not meant to be exhaustive, nor is any one member expected to implement all of the actions that we suggest in the What You Can Do chapter. Instead, we suggest you choose the activities that would be the most effective in your setting and that best plays to your strengths. So the chapter is divided into 6 subheadings. Again, you can see them on the slides. We've tried to organise the content in this section so there's really something for everyone, regardless of your organisation's resources or your own advocacy experience. We really hope this toolkit can be tailored to your needs and that you can draw something useful from it. So we thought we'd use this webinar as an opportunity to give you some examples of the recommendations and practical tips offered in the toolkit and just go into a bit more depth and try to give some more concrete examples to inspire you to follow the toolkit and adapt it to your local setting and let it really help boost your advocacy efforts. Or in fact, if you are not traditionally engaged in the advocacy space, hopefully this can inspire you to push your boundaries and try out some new ideas. So the first example of the 2 that we will go into a little more depth here is actually perhaps the most crucial part of advocacy for heart disease of all. So it will inform all other aspects of your advocacy. So this, of course, is to identify your national CVD priorities. Knowing these priorities, being sure of them, having some evidence behind them, can help to keep your advocacy specific, focused, and successful. So in the toolkit, we recommend identifying national CVD priorities on 2 levels. You may find one level is better suited to your own organisation. You may find that you're capable of doing both. So these 2 levels are keeping track of national progress and statistics and conducting local research. So firstly, let's talk a bit more about keeping track of national progress and statistics. So this can help to create a strong case for governments to take action on CVD. We find that statistics in particular are very compelling and can really motivate governments to shake off their inertia and realise and acknowledge and accept that CVD is a national priority. So statistics can be on a variety of topics. They can include burden of disease, information on which people in your own local and national settings are most affected by CVD. National progress can also be non-statistical. It can be a measurement of whether or not the necessary policies exist to protect people from risk factors. So all of this may sound like quite a difficult undertaking. There's a lot of knowledge out there that we need to gather. So to help gather this information, the World Heart Federation is currently developing a CVD scorecard tool. So this tool is designed for our members. It's a national level tool. And the scorecard will complement and support government health monitoring. So it acts as a tool to hold governments accountable for their commitments. So the way the scorecard will work is it will identify policy gaps and track national progress. It really is, the name says it all. Countries will be scored on a very user-friendly card, and that information will be shared and available for everybody. So this is an opportunity we're very excited about. It's coming up around the corner, and we do encourage you to get in touch if you'd like to know more about the CVD scorecards and how we can involve your organisation. So there are also actions that you can take straight away. Like I said, the scorecard is coming around the corner. We're not quite there yet, but there's definitely stuff that we can do to identify national CVD priorities in the meantime. So collecting national data is a good start. So data sources that we like and we use a lot include academic journal searches. So we use PubMed as an important tool. You can also find data on your national setting by looking at your country's World Health Organization NCD country profile, which are available online. A very easy search into a Google search or other search engine will get you the data straight away. If you'd like to go a bit further afield, there's always the global burden of disease modelling data, which is also available online. Again, a simple Google search should bring that up for you. So these resources may be patchwork together. You may find some more interesting and accessible than others. But between them, they should fill in some of the gaps where data is previously thought to be scarce or unavailable. You can also, if you're struggling, reach out to your local researchers or local academic institutions directly. They may have some exciting data that they'd be happy to share with you. So that's some insights, some tips, hopefully some inspiration on identifying national CVD priorities through keeping track of your national progress. But we also think it can be useful to conduct local research. So we don't go into this in huge depth in the toolkit, but hopefully this can help fill in some of the gaps now in this webinar. So conducting local research is important and a good method in order to obtain qualitative as well as quantitative data which can support your advocacy. In our experience, our best and most successful advocacy strategies and plans are underpinned by really solid data. That said, we have learned over time to be quite flexible with the types and sources of data that we use to inform those policies. For example, we find that interviews with patients or health workers can also influence policymakers, especially when put hand in hand with statistics. Or you may consider local research to cover information from local registries. Your local government may have some publicly available surveys. You may also find it interesting to do some online searches for unpublished academic papers. I think it's quite important to stress that information, data and research comes in many forms. The lived experience of someone living with heart disease or of someone caring for a person living with heart disease, for example, is a very powerful advocacy tool and definitely shouldn't be underestimated when speaking to your local decision makers or trying to raise awareness about heart health. So, moving on, our second example, where we'll do a bit of a deeper dive in terms of your own advocacy opportunities, is on communicating strategically. So advocacy efforts can have a big impact when the key messages are planned and synchronized. So the toolkit supports you in your communications. The chapter includes key messages on CVD, key messages and some more background information on the high-level meeting in 2018, and also some key messages around cardiovascular disease and the Sustainable Development Goals. Of course, the messaging included in the toolkit, they're just our suggestions. Please feel free to tailor them according to your own local languages, your setting, your disease burden. Really make the messages your own in order to maximize the impact of your advocacy. So going beyond the toolkit for a moment, we have some additional tips for your communications work. There are several pointers that we've found useful in our own advocacy. We'd like to share them now on this webinar. So firstly, I think it's important to remember the value of using different methods of communications when you're advocating. This means you can reach different audiences. So at the World Heart Federation, we use a variety of communications messages, both in our advocacy, but also in our outreach to you, our members, and with fellow NCD organizations. So this includes social media, also the radio may be a popular communications form in your setting, press releases, press conferences, also open letters to decision makers and policy makers. We find that sometimes the best way to get the door open is actually to go quite traditional in terms of just sending a letter to your government. So another tip that we find helpful is to know your target audience. So knowing your audience means you can tailor your message more effectively. So in order to get out there and have a good idea of who you're talking to, it's good to have a feedback mechanism. I'd say another tip is don't be afraid to seek feedback when you're communicating and advocating. You can test key messages on your colleagues, for example, but it doesn't have to be colleagues, also family and friends can also help sort of give you a sense of whether you're heading in the right direction. And the last thing I would say in terms of advocacy communications is you should have a key ask for every key message. This means your advocacy will be more action-orientated and people will be moved to change their behaviour or change their policies more quickly. So moving on to the next chapter, key opportunities for CVD advocacy. We find that advocacy work has the greatest impact when there is a so-called hook to hang your message onto. So while chapter 3 of the toolkit offers guidance on how to conduct advocacy work, this section, chapter 4, sort of focuses more on the when. So it presents key moments and key opportunities that you should push your agenda forward in. By key opportunities, we mean moments, events, or critical time periods in which we as the CVD community can amplify our message, bring in new supporters, mobilize existing supporters, or work with global partners. So they really are rich opportunities we should be working within and exploiting where we can. So important now to remember that decision makers who bring about change, such as ministers of health, they often have very pressing demands on their time and attention. So it's important for us to really drive home our key messages when these opportunities arise and we can be sure they're listening. So the chapter outlines key opportunities, including how to integrate advocacy for CVD across the Sustainable Development Goals. Alistair's already spoken about that. A new mechanism called the United Nations High-Level Political Forum, different from the high-level meeting, also quite important. We give information on that in the toolkit. There's another World Health Organization opportunity called the Global Coordinating Mechanism on NCDs. This is quite an interesting one. It invites people living with NCDs to share their stories on an online platform. Also important to flag the Mexico Declaration. So this declaration was signed at our World Congress of Cardiology last year in Mexico. We saw many of you there. And so do keep reading that chapter for the key opportunities for your advocacy. And finally, the conclusion to the toolkit. 3 key things to underline in our joint advocacy efforts, especially ahead of the high-level meeting on NCDs. So of the 3 things, firstly, progress towards the 4 time-bound commitments and towards the NCD targets in the WHO Global Action Plan is poor. We know this. Most countries are not honouring their commitments. So following the endorsement of the Sustainable Development Goals, it is time for us to refocus and redouble our efforts. So organisations already engaging in advocacy, we encourage and are hoping to empower you to scale up your efforts. Those of you who are new to the advocacy space, welcome. It's time to get started. Second, the UN high-level meeting on NCDs in 2018 is our big next global policy milestone. So we must make the most of this opportunity if we're to see any meaningful change or action in tackling NCDs. So Alistair will go in more granular detail about this meeting further on. Thirdly, while the UN high-level meeting on NCDs is a global event, the real focus here is moving more towards national efforts. So concerted action by our World Heart Federation members is vital to ensure that countries achieve progress in tackling CVD. So we thank you for all your work so far and we hope this toolkit can help you as we move forward. So with that, I'll hand over to Jeremiah, who has he'll be hosting a brief question and answer session on the toolkit. Jeremiah, thank you.
So a big thank you to Joanna and Alistair for taking us through the first section of this webinar. So before we go on to the next section on the high-level meeting itself, now is a chance for any questions or clarifications you have about the toolkit itself. We have quite a few people on the line who've joined us for the webinar. So the best way to ask questions is by using the box that you'll find on the right-hand side of your screen, where there's a text box where you can type in your questions to us, and then we will field those between us and hopefully answer those questions that you have. So we'll just give a few moments for people to type in their questions and get going. While we're waiting for those questions to come in, something also that we would find very helpful in terms of feedback from you is if you could let us know, drop us an email, and tell us if you've used the toolkit, which sections you found most useful, and if you're engaged in any advocacy on national plans, 25 by 25 targets, or the higher level meeting to date. And also let us know if there's anything that you think is missing in the toolkit. So we have a question related to the key messages, which is it possible to have messages directed to our governments that we can actually deliver? So I'm interpreting that as, and please do follow up on your question. Oh, I see a little bit's been added. Okay, so that question's from Elizabeth Kutumia in Kenya. And I would say that the messages that we've currently developed in the toolkit are a good starting point, but that we're still working on some specific questions which we will come to in a second related to the process for the high-level meeting and what we want to see as organizations, as civil society in terms of the format and how that meeting is run. And those key messages will be coming out in the near future. But in terms of other things related to CVD, I think it's very important, as we've stressed, to think about the national commitments and the time-bound commitments and how those relate to your particular context. And to think, how well is your country doing on those commitments? Do you have some experience or knowledge that can help in helping them reach that commitment and make progress on those, and really focus on that side of things, so translating the commitments into your local context. We have another question, which is, what are the actual tools WHF are making available as part of the toolkit? It's coming from George now. And I'll hand to Joanna for that one.
Hi there, George. Thank you for your question. In terms of the actual tools in the toolkit, you'll find these in Chapter 3, the What You Can Do section. So probably the most tangible, traditional type of tool is the template letter that we supply. So we speak about that in Chapter 3. You can actually find the example that we have used successfully in the appendix of the toolkit, so right at the back of the document. Other tools that we provide are example key messages. So going back to Elizabeth's question before, we do strongly advise you to take those key messages, to digest them, and then see how best they can be used in your own contexts. So we're aware that we have many different members. We have members who have very distinct voices at the national level and the local level. So those are tools that you can adapt and use as you see fit. Again, in terms of more sort of tangible tools, we talked about the scorecard that the World Heart Federation is developing. We're super excited about this resource. So this will be a sort of data collection and policy monitoring tool. If you're interested in that, please do get in touch. We would love to be able to do this work in South Africa, also in Kenya where you are, Elizabeth, but the invitation really is open to all of our members. So like I said before, Chapter 3 is where you're heading for the actual tools, and we have sort of 6 sections within that chapter. So there are tools for everybody. There are the more sort of intellectual tools for those who don't have lots of resources but may have lots of enthusiasm for communications. So that would be the key messaging, also the information we're providing. And we have the more practical tools like the scorecards for those who have that data gathering enthusiasm and expertise. I think it's also useful to remind everybody that across the whole toolkit, we do flag out to other people's tools. We don't believe in reinventing the wheel, and the World Health Organization in particular is developing more and more tools every year for the NCD community and the heart health community. So you can see at the back of the toolkit document, I think it's in the other appendix, we've listed out the useful links, and many of those are practical tools you can use yourself. So thinking, George, seeing as you asked the question, I think it would be especially interesting for you to go and explore the tools provided by the Global Coordinating Mechanism at the WHO. You can find the website at the back of the toolkit, because we know that your organisation has a really strong focus on elevating the stories of people living with heart disease, but also the people working to care for those patients. So hopefully we have a tool for every member, and you can find the majority of them in Chapter 3 and in the appendix.
Thank you, Joanna. So there are no more questions related to the toolkit itself. So I think now is a good time to hand back to Alistair, who will take us through the process leading up to the high-level meeting in 2018 and what we are hoping to see in terms of the format of the meeting that is held. And then after that, we will have another chance for questions. So if you do have still a question related back to the toolkit itself or the process, we can take those after the next section. So Alistair.
Thanks, Jeremiah. So moving on to next steps. Though the high-level meeting will not take place until next year, preparations for the meeting start well in advance. This is especially important for us as civil society. We will have to advocate strongly to ensure that the type of meeting that we'd like to see does indeed take place. For example, a meeting that's held at the best time, that it's long enough to allow a meaningful discussion to take place. And we also want to make sure that our thoughts, data and input are included in the outcome document, both the World Heart Federation and all of its members. The NCD Alliance is leading civil society preparations for the high-level meeting process in consultation with other NCD federations such as ourselves, the Union for International Cancer Control, the Framework Convention Alliance and many others. So the first step in the process is when WHO submits a progress report on NCDs to the UN General Assembly. That takes place in August or September of this year, and the Assembly will then discuss this report a couple of months later. The next step will be the regional preparatory meetings, which would take place from October 2017 to March 2018. These are not yet confirmed, but would allow governments to start planning early and to set regional priorities. For these meetings, we would push for multi-stakeholder and multi-sectoral elements of the meetings, so including civil society, academia, relevant private sector discussions, and also including ministries beyond just the Ministry of Health, but who also have a stake in NCDs. Then, at the beginning of next year, in 2018, the UN General Assembly will adopt a resolution on the format of the meeting. So this will include details such as how many days the meetings will last and when it will take place. We and the NCD Alliance and the other federations are advocating for a meeting that includes ministers and heads of state, and which would last for 2 to 3 days to allow for in-depth discussions. The next step after that would ideally be an interactive civil society hearing. Like the regional preparatory meetings, this is still yet to be confirmed. Any such meeting would give civil society and of course people living with NCDs a chance to add their voice and thoughts to the review process. The hearing would need to take place at least 2 months before the high-level meeting itself in order for any recommendations that civil society or people living with NCDs had to be included in the outcome document of the meeting. Then from April to June of next year is the likely time when negotiations on the nature of the outcome document will take place. Though the outcome documents will not be legally binding, we are aiming for the strongest possible recommendations to urge Member States to act quickly on NCDs. And then finally, to the meeting itself. The most likely dates for the high-level meeting are either June or September 2018. We are pushing for the meeting to take place in September, just prior to the annual UN General Assembly meeting, as this would mean that more ministers and heads of state would be in New York City and would therefore certainly be able to attend the meeting. So that's a short summary of the process. As you can see, we need to be ready to influence this at various points over the course of the next 12 to 18 months. So we ask you to stay engaged with updates in order to know when to advocate at the national level. And as you can see, there is still uncertainty over the timings of some of the stages of the process, even at the meeting itself, but we'll update you as soon as we know more. But nevertheless, there are preparations which we can begin now. Firstly, following the webinar, hopefully later this month, we will be sending out a survey. This is for us to gauge how best we can support you in your advocacy around the HLM, to what extent you would like to be involved in this advocacy, and also, most importantly, to learn your priorities so that we know where to focus our attention and efforts at this busy time. A second action, as I mentioned earlier, is to stay up to date with preparations for the high-level meeting via members' news. We will make sure to share any and all updates we receive as and when we hear from them from the NCD Alliance or other stakeholders in Geneva. Thirdly, of course, we encourage you to use the CVD Advocacy Toolkit as much as possible and to adapt the recommendations that it contains to your national context. And just to reiterate something Jeremiah said, we do encourage you to give any feedback at all on the toolkit. We want our resources to be as useful and as user-friendly as possible, so any and all feedback is welcome. Fourthly, we would also love to hear from you on any current or future priorities on CVD prevention and control in your setting. We need as much information as you can give us to help form the WHF's position and our main demands at the high-level meeting. Anything we say or advocate for at the HLM or up to the HLM, we have to back up with evidence and stories to help add colour to this evidence. And your experience in successful programs or indeed in the challenges you faced is essential and extremely useful for this work. Our colleague Lindsay Cannon, the Programme Officer at the World Park Federation, is working on the national CVD scorecards that we mentioned earlier, which aim to highlight successes and gaps in CVD prevention, control and policy. So please do get in touch if you would like to know more. And finally, we also encourage you to join the World Heart Day Global Policy Call later this year on September 29th. This call is part of a 2-year campaign for governments to implement robust and fit-for-purpose CVD surveillance and monitoring systems. This can help governments to understand the nature of the burden of CVD in their countries so they know where to concentrate their efforts. And of course, it can also help to provide the data and information needed to help measure progress towards the 25 by 25 targets. I'll now hand back to Jeremiah for another quick Q&A for any questions on the high-level meeting.
Thank you, Alistair, for taking us through the next steps leading up to the next UN high-level meeting. It seems far away at this stage, but we know that it will come around quickly. And because so little has been achieved in some settings, this meeting has become even more urgent. I think we are all agreed that as civil society, we need to be prepared well in advance to ensure our voices are heard at the event. So we'll take another pause now in case you have any questions regarding the preparations or action ahead of the high-level meeting. Once again, please do type your questions into the box that you'll find on the right-hand side. I think while we're waiting for those questions to come in, I will, well, we already have a question coming in from Juan Carlos Santa Cruz from the Colombian Heart Foundation. Well, while we're waiting for that question to come through completely, we have a question related to civil society preparations that took place prior to the previous two high-level meetings in 2011 and 2014. So perhaps I can ask Alistair to give us a brief overview of what civil society did before those meetings.
Sure. So the first high-level meeting in 2011 included preparations that were a lot more extensive than those that took place in 2014. So some of the elements of preparation that we mentioned on the timeline slide, such as the regional preparatory meetings and the civil society hearing, both took place before the 2011 high-level meeting, and indeed there was also a civil society task force. However, not all of those elements were included in the 2014 high-level meeting, and in addition to that, there was greater representation from ministers and heads of state at the 2011 high-level meeting than the 2014 high-level meeting. And so for that reason, we are trying to prepare as far ahead as possible. We want to make sure that regions are able to set priorities prior to 2018, and also that civil society has a strong voice and an opportunity to make our voices heard in the final outcome document. Prior to the 2014 meeting, for example, there was a civil society hearing, but it wasn't at a long enough time in advance of the high-level meeting itself, so that the recommendations there could be really used at the meeting. So that's why, though the meeting seems far ahead in advance and a lot of, it seems slightly early to get going on some of these preparations, that's why we're starting now to try and repeat the thorough preparations of the 2011 high-level meeting and try and make a strong and as concrete an outcome document from the meeting as possible.
Thank you, Alistair. While we're waiting for any further questions, something that we are often asked is how organizations can attend. And just to give a quick overview of how that's worked in the past, at the moment we're not sure how many people organizations can have on their delegations. We will of course lobby for as many places as possible to ensure that there is a broad representation from civil society. In the past, places have gone to organizations with United Nations ECOSOC. So we know that there are a few organizations among our membership with that status. The WHF has that status, and so that's one avenue. Also, there are potentially the option is that the participation can be widened, but it's also important to remember that space is very tight. So we're looking, for the last few meetings, we've been allowed up to around 3 people on our delegation to attend, but we will obviously continue to advocate for ensuring that we can have as many people from the CVD community represented as would like to be there. And of course, one of the avenues for that is for civil society to be well represented among the speakers throughout the meeting. For example, if roundtables are held, we would want to see representatives from the CVD community taking place in those roundtables and bringing those different voices, whether they're from the health professional level through to people living with CVD. So that's just a quick overview of the attendance and what we're hoping to achieve in that area. It doesn't look like we have any other questions, so I'm hoping that that means that everyone feels comfortable with the process to date. But if you do have any queries about how the build-up to the high-level meeting will go, please don't hesitate to get in touch. So I think, given that we don't have any more questions, I would just like to quickly summarize what we've heard. I'd like to thank you very much for joining the webinar. It's been very useful to have some of those questions put to us, but we do hope that you will send any others that you have. I think some of the points that Alistair raised in terms of the actions are worth mentioning again, so please do fill in the members survey when that comes round. This is really a crucial tool for us to be able to represent your needs and to reflect what you think are the priority issues when we're doing our advocacy work here in Geneva and at the UN in New York. Please stay up to date with the high-level meeting preparations via the members news. We will try to make sure that we keep regular updates coming based on the changes and what's happening in terms of the negotiations for the meeting. We do suggest adapting the toolkit recommendations to your national context. If you have any questions about that, again, let us know. We will be sending out a communication to members in the next few days related to the CVD scorecards. So again, we welcome your input on those. And as Alistair mentioned, please do get in touch regarding the World Heart Day policy call. So again, we'd love to hear from you about the toolkit as well. I'd like to thank Joanna and Alistair for the preparation, both of the toolkit and of the webinar. As we mentioned, this has been recorded and will be available, so please do share it with your colleagues or anyone else that you think it would be useful to have this information. And we hope that you will join us for future webinars. So thank you very much, and we'll be in touch again soon.
Thank you.
Thank you guys. Bye.